It's coming from here.
We can start parent survey.
Yes.
Distance learning, those kind of things. Any questions about that?
I have a question on the number. That's the number of parents who completed the survey. Was there any way for you to calculate how many students that involved? I know some parents have more than one child. And
Sorry, let me get rid of all these write-ins. We can see that they picked the value of their grade level.
I counted those numbers. I think there was maybe 4,000, or a little bit over 4,000 on those grade levels.
Right.
If that was the actual number of students we're talking about or not. And it was 3,000 parents. Is that right?
That's right. It was 3,062 that completed the survey, but they could pick that they had students in multiple grade levels.
Right.
Yeah. Good question. Anything else?
Am I correct if you added the number of the parents together that wanted either full-time face-to-face instruction or a hybrid, did that come out close to 80% or?
48 and roughly 40, so about 80, 86.
86, okay. So about 86% wanted some form of face-to-face instruction, either hybrid or full-time.
Yes, sir.
Okay.
And then the last, I'm sorry, was there another question? I feel like I cut somebody off. Okay, the last question was made to return to the buildings. Would you prefer that your child be able to participate in a virtual learning environment? 64.7% or 140 or 1,446 said no. 35.3% or 790 said yes. Any questions there?
I'm actually not sure if this is the appropriate time for the question, so tell me if it's not, we're going to discuss it later. But on that last slide there, the last picture you had that shows the amount of people that want to go full virtual, the other day, percent into a virtual academy.
Does virtual academy include grades 8 or 9 through 12, or does it include?
Yeah, so the virtual learning academy is kindergarten through 12. So this question here asked the parents if we went in some form of returning to the buildings, how many of you would like to have a virtual option on top of that? So the parents who already have their children enrolled in virtual learning academy didn't answer these questions. So this would be in addition to that. So we have a little over 2,000 in the Virtual Learning Academy. Now we do have additional about 200 or so, I think, perhaps, Dr. Palmer, is that right? Who are on a waiting list who ask after our deadline to be considered. So we're considering those now. To accommodate a number, that number is 790, and that's the number of people that responded to the survey. We would have to significantly retool and repurpose staff, I think, to accommodate that. So, okay.
I guess the one thing I'm confused by, and please, it's probably very simple and I just don't understand it, but if we're going completely virtual today, how can we have people on a waiting list to go virtual?
Okay, so the people that are on the waiting list are for the Virtual Learning Academy, okay? That is where parents have made a semester commitment for their student to be a part of that. So the students that we are operating online for all the other students now as in that mode. So that is the students that have been assigned to physical classrooms. The teacher is just delivering the instruction virtually to all of the students. Okay.
So is there a cap on the number of people we can put in our virtual academy? I mean, could we not, if there's another 20% that pop in and say, if you're going back to school, I want to go virtual academy.
It's two different programs. That's what I'm saying. So,
but is there a limit of people we can put in the virtual academy?
Yeah, it's limited by the number of teachers that are assigned specifically to the Virtual Learning Academy. We have some staff members that are actually teaching in both. We have some staff members that are exclusively in one or the other.
Okay, so it's limited by the number of staff we have assigned, but if we reassign, we could actually expand it if need be.
Well, that's something we'd have to really take a look at. I mean, one of the things that we could possibly do if we're, for example, if we're in a hybrid, operating in a hybrid model, depending on the number of students we have, some of those students, instead of coming physically 2 days, could participate potentially online the whole time. So it really does depend, and we'd have to think about how to do that.
If I understand it correctly, we have basically created a new school starting last March into today, where we have about 2,000 or 2,200 students. And to staff that, it required pulling teachers, especially at the high school level, who were certified in certain subjects and being assigned those classes. And I think it's tremendous, and the people who have done that need to be complimented on the fact that they were able to create that school and do that. And I don't know that much about the elementary part of it, but I've talked with the people about the high school part, and those classes are pretty full right now, I think, but it's going full force. And of course, there's times that it stumbled, but they're to be commended for making it work from something that was unheard of last March when we closed down until now when we're opening it up. And the other online learning part, the part that we asked the question about here on the survey, is totally separate. If there's a way to make that work, I think we should, but not necessarily for the virtual academy, because the virtual academy can be a big plus for us in the future, whether we're in a pandemic or whether we're operating normal. Because it's, if you'd asked me if they could have done that, I wouldn't have thought it could have been pulled off, that you could have started a whole new school from that period of time and then get teachers to staff it. And I think the four high schools worked together to do the high school. They did not. And of course, Dr. Palmer gets a lot of credit for that too, but the assistant principals there worked hard at pulling it together and making sure they had teachers who could teach the classes. And there's a limit by the limit of the number that can be assigned for class load, just like anything else in a math class or whatever. But
so to accommodate more students in the Virtual Learning Academy, we'd have to increase the capacity, and that's a staffing issue. So the kids that are traditionally enrolled who happen to be online for the first 7 days. This is the population we're talking about here.
Right, okay, I understand, that makes sense now, but it didn't make a lot of sense how we couldn't, if another 100 kids want to be in it, they're either gonna be in traditional classroom or the virtual academy. I don't see how you couldn't transfer those into the academy and expand the academy to whatever level. Okay, okay.
Would we like to move on to the teacher survey?
Do any board members have any more questions about the parent survey? If not, I would ask Ms. Grizel to proceed with the with the teacher survey. Okay, go ahead, Amy.
So the teacher survey had 704 teachers, and this would be our professional staff complete the survey. You can see that they were predominantly write-ins at 45.6%, which was 321 teachers. Another 236 would prefer to come back hybrid, and then 147 wanted to have the students attend fully in person every day. And the write-ins are much the same as the parent survey. You can see they say virtual, 100% online, online only. And you can feel free to scroll through there. Continue online, continue virtually, distance learning, full remote. So you could just safe in saying that those 321 teachers would like to remain virtual. And there was only one question in this survey. So do you have any questions about that?
So we have about 54% of the teachers that wanted to return in some form or fashion to face-to-face instruction, either hybrid or full-time. Would that be correct?
Yes.
And we had 88 or 87%, whatever it was, 88%, I believe, of the parents who wanted to return either full-time or part-time to face-to-face instruction.
I believe that's correct, yes.
Okay, thanks.
Any more questions about the teacher one? Is pretty straightforward. The support staff was just a little different. Is it okay to go ahead into support staff?
Yes, please.
So in support staff, we had a vast majority that wanted to attend fully all day, every day, or hybrid, those models together. Only 46 that wanted to, and they do also say the write-ins predominantly remain virtual. There was a total of 344 support staff that filled out the survey. 115 want to attend fully, 183 would like to do hybrid, and then 46 were write-ins. Any questions about that? Are you all still there?
I had a question, Amy, on the support staff. Then about 86% of them wanted to return either full-time face-to-face or hybrid. Am I correct on that?
That is correct.
Okay.
These are support staff, though, so I think you have to understand that they may have been concerned about a job and a pay.
I understand. Thanks.
Yeah. Any other questions?
Anyone, any more questions for Amy?
Or any questions about the survey results in general?
Thank you, Amy.
Yep. Thank you.
Good job. So now, I think each board member owes it to the public to let them know what we're thinking. And, or maybe, maybe you don't have thoughts on it, but I want to give everyone a chance if you want to state what you're thinking we should do. So, everyone okay with doing that now?
Yes, Chairman Hughes, I'd like to go first if possible.
Yeah. Yes, Randall, you had a little feedback there, but go ahead.
All right, and forgive me for the length of this, but I did write out my remarks. First, I want to thank all the parents and students who've had to adjust the way they live and learn due to the pandemic. To the administrators, teachers, support staff, and central office lead team, your work has been nothing short of Herculean. Your efforts have not been taken for granted, and we applaud your time and your talent. Our children, our future. Those words appear prominently on the Sullivan County Department of Education's website, and no matter what background we come from or what viewpoint we have on this issue, that idea, that hope that our children are our future is something upon which we can all agree. As we face the incredibly important decision about reopening schools in the midst of a pandemic, I hope we can also agree that when we disagree, we will extend to one another civility, grace, and kindness. The pandemic has been paralyzing, but it does not have to be polarizing. Frankly, there are no simple solutions. If we open virtually, single parents, parents who both work outside the home, and other primary caregivers may not have the means to assist their children. Students may face domestic violence, be left alone in unsafe neighborhoods, and suffer food insecurity. In all likelihood, current learning deficits will only grow because nothing can replace the engagement, energy, enthusiasm, and expertise offered by a gifted teacher. Marginalized and disenfranchised students will not receive the extra care that they need, as IEPs and 504s will be difficult to implement remotely. Students who've been traumatized by adverse childhood experiences and mental health considerations will not have a guidance counselor or frontier health expert available just down the hall. Vital extracurricular activities like band, drama, sports, music, art, and clubs might not be possible. Technology issues will be problematical too, as parents and even teachers feel unprepared for instruction in a virtual world, and some subjects are simply nearly impossible to fully learn in a remote environment. Opportunities for fostering empathy, collaboration, and conflict resolution, all part of navigating through school, will not be available from a desktop or laptop computer. I want nothing more than for school and life to resume normally. But it's simply not that simple. Nationally, Major League Baseball, which just resumed play on July 23rd under strict protocols, has already had to cancel dozens of contests due to COVID-19 outbreaks among teams. Over 60 NFL players have already opted out of the upcoming season, and NCAA and smaller conferences across the country have canceled their seasons due to concerns over recent outbreaks. Even locally, high school athletes and coaches have tested positive, already disrupting practices, games, and student athletes and coaches' health. Last Wednesday, Dr. Anthony Fauci said that everything should be done to reopen schools, but that doing so might not be realistic in areas where the virus is on the rise. And he specifically mentioned Tennessee as a state showing an increase in percent positives. Last Thursday, a school in Indiana opened and closed on the same day, and the superintendent stated, "We knew it was a when, not if, but we were shocked it was day one." And this past Friday, reports from Johns Hopkins University and the Association of American Medical Colleges stated that the epidemic is not under control and that deaths could be well into the hundreds of thousands. And just 2 days ago, Ballard Health said the Appalachian Highlands region positivity rate was higher than metropolitan areas like Memphis and Nashville. Once again, I am a fan of opening schools in person with all the benefits that schools offer communities and students. Data, science, peer-reviewed research exist on both sides, both those who wish to open virtually and those who believe we should begin traditionally. Again, I encourage people on both sides of this dilemma to not get angry or frustrated with the other side. People deserve respect and kindness as we try to navigate through this pandemic. Our common goal is, after all, our children, our future. On July 8th, this board presented a 31-page framework for opening the 2020-21 school year, part of which states, and I quote, "Schools in Sullivan County will open only if there is 0 to moderate spread of COVID-19 based on cases per 100,000 and health department cluster evaluation. If there is severe community spread of COVID-19, then schools should prepare to operate in a remote environment." And yet we're voting today on reopening schools despite what we said then. I want nothing more than to reopen schools safely, promptly, and face-to-face, but I simply cannot dismiss the numbers. My hope and prayer is that students and staff will soon be able to forge meaningful relationships with one another, learn and grow together, and realize the full potential that is fostered by schools and led by teachers in a face-to-face environment. But that time, in my opinion, is not August 17th.
Thank you, Mr. Gilmore. Does anyone else want to volunteer to go next?
I'll do that. I hate to follow Mr. Gilmore with that eloquent speech because mine's not written and it's not eloquent. I have listened to many parents and many teachers during the last few weeks talk about what their individual needs are, and I have talked to many students about what they want to do. The biggest concern that I've heard from parents is, I need help because I'm not here during the day. My students need someone face-to-face to help them. Teachers say they miss being face-to-face with the students. They are making the virtual school work. They're making internet work, but many of the parents are struggling. I've had some call and say, there's just no way I can work. There's no way I can have any income if I don't have something to do with my students. My goal is to find a way to meet the needs of everyone involved. Those parents who need help with their students and those who are afraid to send their students to school. I'm convinced, as talented as our staffs are, that we will be able to provide that. We created a new virtual school between March and today to meet the needs of 2,200 students, and I think we can meet the needs of others. But one of the things that was most telling that a teacher gave me 2 days ago was that if we do make a change, please announce in plenty of time for us to make the needed changes. Give us 2 or 3 weeks to go from one to the other. And I'll be more specific in what I'm recommending. I'm recommending that we return to a hybrid schedule on August the 17th, that we remain on a hybrid schedule until the week of the Tuesday after Labor Day. During that period of time, it would give our teachers to be able to determine whether or not they can do everything that we have, such as social distancing and wearing the mask. That would mean that we would have 2 days of class, and I believe then 3 days of virtual learning. It would be a mixture of both. Are we putting anyone at risk? There's never a time that we're not going to put someone at risk, no matter what we're doing. So I would encourage us to try to meet the needs of everyone involved and ease into this. I think if we try to push into it too quickly, that we will fail. And that was my concern about trying to expand the Virtual Learning Academy. If we try to add another 1,000 students, then we're going to end up causing the 2,200 to not be successful there. So I would encourage you to look at a way to meet the needs of each and every one. We have, as you heard the numbers added up, over 80% of the parents want their students in face-to-face in some form or fashion. I think 88%, 87% of the support staff wanted that. We did not survey the students, and maybe we should have. And I'm one of the ones who pushed for a survey. I wanted to know what people thought and what their thinking was and what their needs are. So let's try to find a way to meet the needs of all those as quickly as we can. But if it takes moving slowly or baby steps, let's do that too. Thank you.
I'll go next unless someone else really just wants to go next. I have a huge concern with being online or hybrid until Labor Day. There's so many students that are not participating and can't. If you just look at the chart, if it's 3,000 or 4,000 students that are going to be left behind until Labor Day, how are they going to catch up? We've already been out of school since March. I'm an advocate for starting for everyone in August and giving those that don't feel like they can come another option. But too many parents, I've talked to more than 100 in the last week. All those emails you got, I called those and talked to more. I've talked to many parents who said, whatever you do, please know that my student won't be doing much of anything until they get back in school. We both work. We get home at 5. We put them into bed at 8 o'clock. And you only have to look at this meeting that we're having now to see how much difficulty they are with technology. This meeting we've already crashed once or twice today. That's going to happen in the real world too. I don't think virtual learning is a real option for many of our students. Yes, there will be some who have a parent at home or people to help them that will do okay. I think we can't leave behind that huge number of students and parents that have no other options. It's what we're here for. And I agree with most of what Randall said. There will not be a time for a long time that we will not be opening with some risk. Many parents expressed to me, please tell people that we know that there's a risk. It's our place to take that risk. We know we're in the red. So it's not like the parents don't understand what's at stake. I think Mr. Gilmore pretty accurately, we have a lot of students out there that are hungry, a lot of students we've lost some students. There's some students we're still trying to track down from some schools since March that we don't know where they're at. So I do appreciate what Mr. Gilmore said, that we all don't have to agree on this because this is a very difficult subject. And by the way, this has been a very challenging time for our teachers, our lead team, and everybody. I couldn't be more pleased with what I saw. The effort has just been monumental. But there's nothing that we can or will do that'll keep those children, that will help them keep up between now and Labor Day. So you take March, April, May, June, July, that's 6 months that some students have had no instruction. They're almost a year behind now. It won't be long till they'll be a year behind. How are those students going to catch up? And most likely, some of those students are the ones who need the help the worst. So I'm an advocate for starting face-to-face totally on August the 17th. I respect everybody on this board and their decision, and I agree with Randall Gilmore. Whatever we decide as a board, it's our decision as a board. And I know that everyone here has the interest of the children at heart, even though they may see things a little differently. I will yield the floor now to whoever would like to go next. Don't make me call on somebody. Mark volunteered just in time.
Just in time. Especially the ones that were just at the polls over the last few days. I know we had a lot of questions, a lot of people coming up to us, and I've spent a lot of time talking to the public over the last 3 weeks. And I would imagine most of us have. We've gotten telephone calls, we've gotten emails, but I've been face to face with hundreds, literally hundreds of people asking me questions. And some of the questions, it's really hard to answer. I mean, I've sent a lot of them to Dr. Cox and said, okay, what should I put to these people? Because there are questions I don't know how to answer. And I think that everyone is scared. I think a lot of people are worried about going back to school, but I think that the country is actually opening up, even if it's in a face mask and, shields and things to protect our workers. By all means, we want to protect our workers, but the grocery stores are open, the Walmarts are open, the restaurants are open. It's hard to sit back and say that the education of our kids is not as important as us going out to eat. So I understand, and I do want to take care of everyone. I want to make sure that we protect our teachers because they're the best in the area and they definitely deserve to be protected. But I also know that the things we're getting from like the Sullivan County Sheriff's Department, that child abuse cases are down 75%. It's not that they're not being abused. They're not reporting it. The schools are where the reports, the SROs and the teachers. I had a teacher come to me yesterday that retired yesterday. She said, I just can't do this anymore. She said, me trying to teach a virtual classroom. She goes, I keep very good control. I'm able to say, hey, call down the kids. But now in a virtual classroom, I've got 15 children and their moms are over their back and they're not going to do the things that they need to do. We can't do that. So she had some issues with it and she said enough. So she retired. And I hate that because she's a fantastic teacher. But one of the questions that came along is, why can't the parents that want their kids to go to school have a choice? Because the parents that don't want their children to go to school have that choice. And it's a valid point. I mean, they're saying these are the things we're getting to get. And just during this meeting, I'm not going to say the guy's name because I don't know if he wanted it publicized, but I had another message sent to me from the Facebook community right now. It says, if you guys want to see something ironic, tuned into what is supposed to be the Sullivan County board meeting, no sound, huge connection issues, and that's with 12 people in the meeting, yet they want our kids to learn like this. It's a valid point. It makes issues. I thought that a lot of our county had connection issues and had internet issues, and I thought it was mostly the rural areas. Yesterday at the polls, I was talking to another family and I said, I don't understand. I know that there's areas, but we're sending out hotspots. And she said, I live in Sugarwood. Sugarwood is one of the most expensive areas, subdivisions in our area. The newer part of Sugarwood does not even have cable. They don't have internet. They don't have that. So that was shocking to me. And they say, I have 3 kids and a husband that works from home. It is absolutely impossible for me to do online education. Can't do it. And that's in a very nice neighborhood and a very good part of our area. So again, those are the things that I understand that people have issues, but we have major issues with. Well, Randall even said that. I mean, a lot of these kids rely on us to be fed. It's just a reality of the area that we live in. So I agree with Randall when he says in July we voted on this, but I think a lot of that information has changed. I mean, we were looking at something that had very little guidance, had very little input. Even Dr. May says, at the time we took what we thought was best. I think we do need to look at this. I think we do need to expand it. I think our children need to be back in school. And that's pretty much where I stand on it.
Thank you, Mr. Cyrus. We have 3 left to go. Who wants to be next? Matthew's left, so. Mr. Robinson? Okay, thank you, Mr. Robinson.
I guess, first off, I want to say sorry to our teachers. I don't feel like we kind of listened to them at the first, but I have kids in our school systems, and I've seen Wednesday and I've seen Friday. Our teachers are trying everything they can. They're trying their best. My 8th grader, it's a little easier there. You got your 3rd grader, my 3rd grader, they're struggling. They're not used to being on that laptop. They're not used to doing their homework here, and somebody's having to be right there with them the whole time. And then it's like, I think Joan said, or somebody said that the parents is right behind the kids. Well, you all know we'll be in this meeting, and sometimes one of us will forget to mute that mic. So all them kids is hearing everything that's going on in the background. I personally believe the hybrid is what I'd like to see for 4 weeks. We give our teachers enough time to bring these students back in. They bring their laptops in. They can go over all this stuff with them in school. help the students be able to understand how to get to their homework, how to get online, make it easier on them when they're at home 3 days. That's the biggest struggle. Last night I worked graveyard. I came home this morning and had to stay up till around 10. That's fine with me. I'm a dad. I'm okay with that. I'm not fussing. But it is hard on our parents. But we also I don't want to go full steam either. I don't want to go 5 days a week. Because I got people that I don't want to see stuff happen to if my daughters bring something home. Okay, I'd like to see the hybrid for 4 weeks. We look at the numbers. We get with Dr. Mays and Dr. May, see how our going hybrid is actually affecting the numbers around our area. And then we can decide whether we actually want to go that 5 days. That's just my thoughts. I'd like to go ease into it. We went virtual for the first 7. I'd like to see at least 4 weeks. We go the hybrid, get our kids in there 2 days a week, go 4 weeks, and then we can discuss the 5 days a week. That's just my thoughts.
Thank you, Mr. Robinson. Ms. Thomas?
You know, our children live at home with their parents. Parents go out to work, they come into work. Many are with their grandparents. I've seen some research for schools that have continued, some conglomerates, but I'm not sure of the incidence of transfer of COVID virus from teacher to child or from student to teacher. We don't have much research on that. I personally am in favor of school going back and taking the precautions. This has been a hard decision. It is hard on teachers. I can't imagine teaching a classroom of students and virtual at the same time and the kind of interactions that go on in classrooms. I've spoken to several special ed parents whose children do have special needs that it's virtually impossible to do over a virtual setting. I wish we had to follow. So I'm in favor of going back.
Thank you. Mr. Spivey, I think we just lost Mr. Spivey for a second. Are you there, Mr. Spivey?
I'm here. I'm sorry. Sometimes I'll turn depending on if my kid's running the room, I'll turn my camera off. I mean, I think if anybody right now is being 100% honest, one of the truest statements in our framework that we just approved 7-0, is that we will make mistakes and that we're going to have to adapt and we're going to have to change. More than anything that I have encountered in the 4 years I've been on the board, I really do think, the 7 of us are elected, so I know that you can make statements, but I really do think that all of us have the same goal. All of us care about children. I really appreciated Mr. Gilmore's comments and how eloquent they were, and I agree with Mr. Jones. Mine won't be near as good. I think everybody has made wonderful points. One of my biggest concerns is the K through 5 age group, and Mr. Robinson alluded to that by pointing to his own kids, and it's the hardest thing to struggle with public education because, K through 2 or 3, maybe even through 5, even though they adapt much better than we do, and I know I'm young, but I feel older every day. They teach me something new every day, but they also, you know, if you're in kindergarten and you can't read yet, how do you learn virtually if somebody's not standing right behind you? I've seen that firsthand. And and as a community, which I really feel like public education is kind of the forerunner for change and advancement in our community, and it really kind of encompasses the American dream. In my view, that's why I'm in so much favor of it, because we really try to be equitable. So whether you're born and you're lucky like I was, with parents with money, or they don't have anything, we try to give everybody the same chance. So my biggest concern is the K through 5 age group in this decision. I don't know. I get a lot of questions too, and I would agree with Mr. Iverson and Mr. Jones and I think everybody, this has probably been the most emails, the most calls, the most contacts from not just parents, but teachers and even just community members, because our decision will affect people that don't even have children in school. I'm struggling with this, to be honest with you. I don't know that any of us are right, but I know we all care, and I hope that, I know we're having our own technical difficulties, but I know this is also being recorded. I hope that all the parents out there realize that even if we don't reply to every single email, we read them and we care, and much more than the 7 people on the board. I can assure you that our lead team and Dr. Cox and our public health officials, they probably don't sleep much, and probably haven't slept well in a long time. That's why I appreciate Mr. Gilmore's comments so much, because whether it's schools or anything from March until now, it is something that I hope none of us ever experience in our life again. But we also have to deal with reality. That's what gives me some pause about going full bore, and kind of leads me back to Mr. Gilmore's point of view, that we laid out a framework and we told people what we were going to do, and we acknowledged we're going to make mistakes, and we'll continue to make them. What I struggle with the most is trying not to be too paternalistic in an elected position. But the odd irony of that is, under the law, when you're in public education, you're in loco parentis, which means you're standing in the place of the parent. And now I know that is a fiction, but for teachers, it really isn't. I mean, I don't know that what I'm saying is the right thing to do or not. I really have a lot of concern with where we are as a region, and I think we all have to be honest with our community and not just say we got to get the kids back in school, but we have to be honest in this role, no matter how we vote, and tell them that we're surging, that Mr. Gilmore is correct. I mean, even though we're in Northeast Tennessee, our positivity rate is higher than metropolitan areas. Now we can fix that, but it's going to take all of us actually listening and trying to put other people over our own self-interest. And that's what's the hardest for me, because I understand, Mr. Robinson, I've got kids, and me and my wife both work, and we don't know. I mean, we don't know what we're doing right now, honestly. I mean, we feel just like all the parents that are out there that are frustrated, that are mad. We got plenty of teachers that have their own kids and have to deal with the same issue. So where that leaves me, right or wrong, right now, and I want to acknowledge that I think we are going to have to probably work harder than we have ever on this board, even harder than talking about consolidating schools or building a new school. Is we got to adapt in real time, no matter what we decide. We can't be so rigid, because that puts everyone at risk. So I agree that we need to get kids back in school. I personally would propose a plan that tried to focus more on K through 5 in a blended model, and I would personally prefer that the middle school to high school age continue virtual. I know that's a motion I would have to make, and we're in discussion now, but I mean, I'm leaning more towards trying a hybrid, but my biggest concern is the K through 5 age group, because of childcare, because of our healthcare capacity. I know that plenty of nurses and doctors and PAs and everybody else that works in Ballard's system that's got to support our whole region, they've got kids too, and they have concern about staffing. And that combined with the ACE, and I know that's an acronym, but our kids that have been through adverse childhood experiences, who really depend on and who rely on the teachers as their parent, as their provider of food, as their comfort, that you can only get hands-on. I'd really like to see some of those kids be able to get back in school at that really young age. I have a lot more hesitance about just opening full bore with the high school, middle school age. I know I keep rambling on, so I'll be quiet. I think everybody here cares about the kids, and we're going to do the best we can, and we're going to adapt just like we all have to. Thanks.
Would anyone like to make any additional comments? Mark, go ahead.
The only thing I would really start to say is, I mean, it depends on what we're going to do. I mean, we're talking about a hybrid plan. We're talking about maybe even going back full board. But the one thing I would say is, if we do choose to change it to where we're going to do either of those options, I would really like to see us open back up that enrollment for the virtual academy, because if 46% of our teachers say that they want to stay completely online, then there's obviously enough teachers to pull from to expand that academy. But if we're going to say we're going back, then we need to make sure that all of the parents have that option to say, okay, but I don't want to send my child back, so I want to go to join that academy. So it depends on what we're going to do, but I want to make sure that those options are allowed, that we're not going to say we got to come back and you have to send your child. So I don't want to put anybody in a bad position. So that's just want to make sure we expand our options if we do.
Anyone else? I would like to just add that, I've said many times, public education is the last best chance for most children that are in the lower income areas to get out. And I'm worried about the period of time and Matthew made a great point, as children get older, they're more and more adaptable and able to sit still for longer periods, and the older students may be able to handle the virtual experience a little better. But I have a really hard time picturing when I was a young parent and had young children and both of us had to work. I just don't know what we would do. And I think about those people, and when I saw that graph, around 4,000 parents and students out there that are lost and are getting farther and farther behind. And I think the hybrid or any plan other than sending those students back to school, a risk that those parents are willing to take, lets them get farther behind. Anyone else have additional comments?
I agree with Mr. Arson. That's one thing I'm concerned about, which goes to my point of being too paternalistic and letting our parents decide if we do open or plan to in any format. And I know this puts extreme strain on our lead team and all the work they've done. And I welcome any feedback from them as well as the public health officials. And I think that if we're being honest, we have to acknowledge that no matter what we say today, that can be subject to change. And it's kind of like the weather. A lot of, the virus doesn't discriminate. We don't have control over it. We need to acknowledge that, but we're going to adapt and try to deal with it. But like Mr. Arson said, I have a big concern for whatever we decide. If we're going to say, yes, we're going to try to open back up in some format of in-person learning on August 17th, that those parents that previously didn't enroll in the virtual learning but may still have a concern now, a few weeks later, as they've seen the numbers rise, that they have the ability to somehow educate their kids without forcing them to send them back to school.
I've talked with, excuse me, I've talked with some of the ones who are involved with the scheduling of these, especially the high school part of the virtual academy. And as a former scheduler at the high school level, I don't see how it would be possible to add a whole lot of students at the high school level to those classes. It would require going back to all the other high schools and pulling teachers from already assigned classes that we've been into for a couple of weeks and creating new sections of those classes. Now, is there an additional way to provide virtual learning for some of those who might need it at the elementary level? There might be some ways. I don't know whether there would be or not. But to increase the numbers at the virtual academy would be like saying we're going to add more students to Kettering. Kettering is probably close to being full capacity right now and will be hard to do. There might be a few places you could find some, but because the virtual school is, for all practical purposes, like a brick and mortar school in my mind when you start looking at the schedule that's been made out. And I would caution us about voting for anything that would hinge on that. I don't disagree that there needs to be a way provided for those who might want it, but
Question for Mr. May. What is the survival rate for this disease? And is there any differences between the survival rate for children and older adults? Is there any models or numbers out there for that?
Yes, there are. Children, as a general rule, have very, very mild to almost no disease as a general rule. There is a rare complication called multi-inflammatory system syndrome that can be very, very serious. But in Virginia, they've only had like maybe 6 cases with 1 death from it. But otherwise, as a general rule, children do extremely well. Many of them are asymptomatic, don't even recognize that they've got it. Now, when you move on into your high school age group, we can see complications there if they have multiple comorbidities.
Thank you. Anyone else like to make any additional remarks before I turn the meeting over to Dr. Cox?
One. Just Dr. Cox, a few of the questions I'm getting just as this meeting's going on, I think it's been a little bit falling off here and there, but one of the questions we're asking is, do we have enough availability of products for the teachers to be able to clean? Have we increased our janitorial staff? Is that going to be something we're going to have to look at? Because if they're required to clean between rooms, between classes, between lessons, do they have the time to do it? Are they going to have the supplies to do it? Are they going to have the ability to do it?
I can tell you that the availability of cleaning supplies, of course, it's been limited as we all have experienced. The Tennessee Department of Education through TEMA they announced a couple of weeks ago that each teacher will get a kit of supplies, and they will be shipping those out supposedly for the year. Now, we didn't know that prior to the announcement. We have since been told that instead of that being shipped in a single container prepackaged, that there will be components of that shipped, and so that is supposed to be coming. I think it depends on, how we go and the frequency of cleaning. Um, we have been able to purchase some things, but the availability of things like wipes, of course, has been limited. And of course, the state through TEMA has been able to, I'm told, secure additional materials. We have not yet received that. So we had a call today, and what we were told is they're on the way. So we don't yet have that. We do have some supplies. We have obviously cleaning supplies for the custodians, that part of their regular cleaning and deep cleaning when we have incidents. But your question was pertaining to teachers, and so that's what we've been advised of.
So it's on the way, but we don't have it yet.
That's right. That's what we've been advised, is that it is on the way. That I think the initial idea was there would be this kit that would have cleaning supplies, PPE, and those kind of supplies for the entire year. That was part of the announcement that the commissioner made with the governor, I think, a week before last.
Yeah, I remember reading that in the thing that each one was going to get a kit, and I asked you about it, and it was a surprise to all of us at the time. So they are sending those, and in effect, we'll be putting those kits together, providing them to all of our teachers, but at this time, it hasn't arrived.
That's right.
And just to kind of jump in on what you're saying too, Dr. Cox, is we just got something, I guess, Monday of this week or Tuesday, that basically we had to get all the information into them, who was the contact person, and that had to be done by the 5th of this week. So, I mean, this is just
right. So Mrs. Nave, I don't know if you could hear her, but we did get information on Monday of this week with a 2-day turnaround. They're going to send the initial, but then there is an option to reorder. So there's a designated person in each building that will be taking care of that. So I'm telling you what we know at this point. Again, we didn't know until just recently, and I know they're working as hard as they can to try to get those supplies out to schools, and I think they're prioritizing it based on the opening calendar of each school system.
I know that a lot of the things it's relative, and I understand that because, I work for the federal government, and whenever we say we need something at certain levels, I mean, because air traffic has to stay open, it's amazing the amount of materials that's been sent to us. So you can't get it at Walmart, but if you get on the certain list, and I'm sure schools have to be part of that, to where they're going to get crates and things to come. So I imagine that when it finally starts, we'll be in good shape. But I guess that is my concern, is that we're talking about doing things that's going to cause the cleaning, but we don't have the products to do the cleaning. So that is a concern.
Anyone else have comments they'd like to make? Otherwise, I'm going to turn the meeting over to Dr. Cox.
I think Jane was saying something, but I got a question also. I don't know. Reopening of our schools here, it's got in there, desks will be facing one way, spread apart. We'll have lines in the hallway, X's and all that. Is all that done and ready? Say if we make a decision tonight that we're going to go face to face on the 17th.
It is not. Ms. Thomas, you're on mute.
You're on mute, Ms. Thomas.
While Miss Thomas is figuring out the technical difficulty, Mr. Iverson, Mr. Robinson's practical questions make a lot of sense, and that's one of my biggest concerns, and I want to highlight in the plan we also adopted and that we rolled out before that Mr. Gilmore pointed to. We committed that not only will we make mistakes, we'll adapt, but that we're going to be transparent and that we need to acknowledge those kind of things. So I really appreciate those questions, and that's part of my biggest concern. And if I'm being honest, and I know we're in elected office, but sometimes we should just be a lot more honest with everybody. The best analogy that I've been able to think of with this is thinking back to satellite navigation systems when they first came out, and they give you directions to a place, and they were the greatest thing in the world. And that's kind of what plans are when you're dealing with something that you've never dealt with before. And you heard of all kinds of people that would drive into lakes or off the side of the road because the navigation system told them to. And I think that's got to be our biggest thing, no matter what metrics that we set or what we try to use in a plan, is that we're going to have to adapt, because no one knows how this is going to play out. And we all have the same goal in mind, and we all want to help our community. And that goes back to, and Mr. Robinson, Mr. Iverson's questions helped point it out, but that was what I was aiming at when I asked about resources, whether that's thermometers or PPE or cleaning supplies, is we can't as a board tell these teachers and these kids that we want them to do something that's impossible, because you can't clean something if you don't have a cleaning supply, and you can't do virtual learning if you don't have devices, which, that's the other thing I think we should be honest about. And we've done a great job, I think, and I commend our staff all the way back to March when this first started, about doing a survey about who had connectivity and who had devices. But, our community sees on the news a news conference that says open up schools and says, don't worry, we have 250,000 computers and everybody's going to have a kit for the year. But the honest truth is we don't have those computers yet. And we're not going to have those computers for a few months. It takes weeks to prepare the package that everybody worked so hard on to get the money for the grants to get those computers. So I just want us all to keep that in mind when we're trying to decide what we want to do. As a board, we got to really respect the opinions of the people that are doing it. And that's why I'd invite anybody on the lead team or any public health official to tell us if you have concerns about any of our comments or our positions. Because just because you say, here's what we're going to do and here's our plan, if it's impossible to do it, then we need to know. So that's kind of my pragmatic concern, is even though we all want to get kids back in school, it sounds good if we say it right now, but if there's no way, if we're setting our teachers and our kids up for failure, then we're not doing them any favors by asking them to come in the door on the 17th.
We could adjust the start date to August the 24th for a hybrid if we voted to do that. There's nothing written in stone that we have to do something on the 17th. That was just that we had gone virtual to the 14th. That's the only commitment we've made so far, I believe, that we are definitely virtual through the 14th. Doesn't say we can't extend it another week and then go to the hybrid on August the 24th, which will be the following Monday.
And I probably should have asked this before when we were talking about it, but that's one of the other questions I've gotten a lot.
I've never been a big fan of the hybrid, as Dr. Cox knows. but I think it's a compromise that's could help everyone.
And I don't disagree, Mr. Jones, at all. And that's your point is a good one. That I should have asked this question earlier because I get it a lot, and maybe if we talk about it, it'll help people understand what we're dealing with at a state and federal level about mandates we have. But you get the question from a lot of people in the community: why not just push back school to the way it used to be and start after Labor Day? And I would welcome any insight on that from the lead team or Dr. Cox or anybody, so they could explain that it's not quite as simple as that may sound to just readjust the whole calendar. And I completely understand as a parent that when you see a school calendar and you plan your year around it, which is really the bottom line. Another thing that we're all dealing with is trying to schedule. And when you're in the middle of an epidemic, it's pretty hard to schedule things if you follow public health advice. Can everybody still hear me? Yeah, and that's my question, and it's not just me asking it because I've been asked that many times. Is all right, if we're surging right now, why can't we just slow things down and push our start date back and get all the kids back in school after Labor Day and adjust our calendar? And I mean, other than a lot of state requirements, I don't know the answer to that. So I guess I'm asking.
Okay, so let me try to start with that question first, I guess. So if we were to pause, I guess, and have a period of time where we don't have students in school or we delay the start, one of the issues that we have to overcome is that we have 200 days, I think, in our teacher contract. So teachers wouldn't be working during that time. So, that's one of the challenges that we have rather. If to your question earlier, do you want to perhaps, I think Mr. Jones suggested that you could say that we're going to, there's nothing magic about the 17th. If you wanted to continue the virtual learning until then and then do something else, you could. The problem that we'd have with the calendar is really one of staff. We would have to, if teachers were going to continue to work and students weren't there, we would have to just have a hiatus, or we would have to figure a way to pay them. And we just don't have the budget to pay for additional teacher contract days unless there would be some other consideration. And I would just, Ms. Buckles, do you have any comments? Okay. Right. So she's just, I don't know if you could hear her, but she was just saying that is correct. If we were to stop the school year at this point, that would be our issue.
And I'm not sure if Dr. May or Mr. Mays is still with us.
I'm still here.
Okay. Because I certainly don't really have any desire to stop the school year, because like I said, I'm really concerned about the kids that would be left behind, and especially the K through 5 age group. But one question that I may know the answer to, but I've got to ask it, is, and it's not a fun answer, I don't think, but Mr. Mays and Dr. May, as far as knowing where our COVID spread is coming from, for the longest time in our region, you heard, well, it's all coming from out of the area, and we can trace it to that. But it seems quite clear. I could be wrong, but I guess I'm asking you all. I mean, can you even adequately trace the spread of COVID in our region right now, or is it past the public health capacity of being able to trace it and it being under control?
Currently, we have the capacity to do the isolation and case investigation along with contact investigation. Uh, we are being taxed with the increased number of cases. We do recognize that the majority of the cases now are related to community spread. We are dealing with a number of clusters, some in our nursing home. That's also being challenging. But as far as, I guess what you're really asking is, do we have the capacity to respond and continue case investigation and contact tracing and placing people in isolation and quarantine? And currently, at the present time, I think we do have that capacity, and we're continuing to ramp up. Gary, do you want to add to that?
No, that's a great answer, Dr. May, and an important question. I think is really a cornerstone question in the opening schools. And Dr. May is correct. Currently, we have 22 active clusters in Sullivan County. So that really tells you, as Dr. May said, it's community spread. What could have been in April, in May, or even the 1st of July, it could have been out of county travel, if you will, and folks coming back. But now it's really not a relevant source. We know what we know in the county is where it is today.
Thank you both for that response. I appreciate it, and I would just urge us all, and I know that you all are in constant communication with our lead team and with Dr. Cox, but I would just urge us all as a board to be transparent about that, because the same parents and kids we want to help, we need to tell them, if you want us to be able to help your kids and help our community, then you need to talk to every other elected official that has the capacity to be honest about that and to get the resources that our public health officials need to be able to allow us to safely educate our kids. And I appreciate that answer and understand where we stand now and feel okay with that answer. But we also need to be honest that may change, and Mr. Mays and Dr. May need help, and I'm sure they'll ask for it. But these same parents that want their kids back in school, the school board can't make that happen, but other elected officials can get those resources to us. So if we work together as a community, all with that same goal, I think we'll get there a lot faster if we're honest with each other about that.
Ask a question. I got kicked off. Mr. May, Dr. Mays, when you refer to clusters, I understand the nursing home clusters. What other clusters? Are these family clusters? Are these workplace cultures? What does that mean?
Okay. A definition of a cluster is two individuals from the same either work area or business, church, or nursing home. And by definition, anything greater than two is defined as a cluster. Now, we do not count family contacts to each other as a cluster. So this is in businesses, and we're seeing a lot of increase, particularly in churches, with community spread and having clusters there. And as I stated earlier, we're also dealing with 7 of our nursing homes that have clusters of our 6 or 7 of our nursing homes that are positive. And so those investigations become quite tricky, and then we have to look at, quarantining those contacts in that work environment or in that church environment.
Symptomatic and asymptomatic, is that correct? Just that they tested, or they tested positive, or they have symptoms?
No, they are the people that have tested positive, and that, to define the cluster, there's 2 positive cases. And then we have to do the case investigation, which is where we find out who were they in contact with closer than 6 feet for greater than 10 minutes. And then we have to take those employees or associates or contacts and place them into quarantine for 2 weeks.
Thank you.
Anyone else or anyone have questions? Go ahead.
Dr. May, the last question, we were talking about the clusters being removed, but all the data we're able to pull up and what we put on our website for people to look at was going back to that state site, and that doesn't have anything to do with clusters or clusters removed. When you're talking about removing clusters, say that there's 10 people at a nursing home, does that turn into one case then? Or how is that actually calculated? And where can anybody look at these numbers that you're talking about, the new numbers adjusted or with removing of clusters?
Okay, well, let me make one point first, in that right now, when we look at our case rates per 100,000, it really doesn't affect what zone actually we are in, red, yellow, or green. We're still in the red. I don't care which metric you use, national metrics, White House metrics, nursing home metrics. We are still operating in the red on the basis of community spread. Now, where the clusters have the potential to make a possible difference is when we look at close congregate areas that are confined. So the 2 major areas we really look at are nursing homes, long-term care facilities, and we also look at correctional institutions, that it can go through the facility very, very rapidly. You can get very, very high numbers that could potentially affect your case rate per 100,000 when you're referring to community spread. So I guess what I'm getting at is looking at those rates and knowing that they're all predominantly community spread now, it's really not going to affect our operational parameters. And this is why that weekly meeting that we have with the superintendents of all 3 school systems and the private school systems is so critical, that you understand the background of how the disease is being transmitted and what are the mitigating factors that we can do to really change that.
Is there a report published from your Thursday meetings? Is there something that the parents or that the community can look at to see where you're standing and what you're looking at for that?
There will be some upcoming metrics, I think, coming from the state, looking at case positivity rates and looking at case rates and case positivity rates. That's going to be published pretty soon, I think, with the state. Right now, the only metric that I've got is that nursing home opening data. We have the capability to subtract those clusters, but at the present time, it doesn't make a significant difference in the decision that we would have to make.
No, sir. I guess what I'm saying is, if you're having a meeting every Thursday and you're making a decision every Thursday and you're looking at taking out clusters or whatever your metrics is at the time, whatever you're using, is there a way that anybody can look that up and see what you're talking about or what your decisions are? Because all that we've given them on our website is go to that state site to look at a number, But if you're making a decision on Thursday that uses something different, it would be nice for people to be able to look and see what it is.
It would be possible for us to share any type of data that we have and use to make that decision. Certainly, we could do that through our website. Gary, have you got any comments on that too?
Hang on, I'm not really familiar with Google Meet here, so I've been struggling a little. But yes, we can. As Dr. May said, pulling out if we have a penal numbers, case rate, any adjustment we've made to the case rate in terms of subtracting clusters or anything like that, it hasn't moved. It hasn't moved the needle much at all. The data that we would use in the Thursday meetings is the same data that the Tennessee Department of Health website uses. It's the same data that is on our sullivanhealth.org data. It's the data elements and numbers are all the same that we'll be using Thursday. It is the context of how we look at that data. If we look at data and see a case rate of 50, and we just had 700 prisoners test positive, you will see a case rate of 50, but we will understand certainly that a penal or jail or drove those numbers. We would understand that if we had a business that was a large employer that had 300 contacts or 300 cases, what impact would that have on one of our elementary schools or high schools? Maybe very little. And that's the kind of discussion that we would have. I don't know if we would have data on a relationship of a large employer with 300 cases versus the impact of, let's say, Piney Flats area of school systems. I don't know that there is data that we could publish in that other than discussion and knowing where those data elements come from. I don't know if I'm still online or not.
You are. Anyone else?
I got a couple questions. I guess how can we consider even going hybrid or any type of face-to-face on the 17th when we don't have the resources we need and we don't have the stripes down the hallway and the X's and the desks spread apart? I mean, in my thoughts, ones that's going to have to put the stripes and move all the desks is going to be our teachers. And we've just asked them to cram all this stuff into, a week and a half to get ready to go virtual where they couldn't be in school. How can we turn around and ask them now to get all of our schools ready in a week when we don't really have the resources? I'm good with the face-to-face. I personally like the hybrid, but I don't see how we can ask our teachers to do this in a week and not have all the resources they need.
Anyone else? Dr. Cox?
Well, I want to thank everyone for all of your thoughts and comments, and I think the length of this discussion only adds more evidence about how complex this really is. And I want to say a special and heartfelt thanks to members of our lead team who have worked feverishly since March when we first started down this road with, and I'd like to thank our principals and building leaders and especially our teachers who really started only a week before our students came to try to get our schools open to instruction. And I had the opportunity today to visit a couple of schools just on the second day, really, of virtual learning, and was amazed at what our teachers and our principals have pulled off in that short period of time. I saw first graders interacting with their teachers, and and teachers having little TV studios pretty much set up in their classrooms. I would also just comment, that it was, and this is something personal, I would say, a little bit eerie, being in a building and it being quiet in the halls, and then going into the classroom and seeing the teachers teaching virtually, because schools were built, our system was built to be a social organization. And all of the research that we've been following talks about the collaboration that is necessary to foster good learning. But at the same time, we've all been trying to figure out how to manage and mitigate the impacts of a community and that's experiencing this pandemic. And this is my 22nd year as a school superintendent. I've never been faced with a challenge quite like this. And again, I just think it's a testament to the terrific people that we have to be able to pull off what we have to this point. So I wanted to say that. Just in response to some of the discussion about how we should proceed from here, one of the things that I think I would be remiss if I didn't point out, really, regardless of what plan that we adopt, some of the realities that we face in bringing students back into the middle of the prospect is that we have certain guidelines that we must follow from the State Department of Health. And for example, right now, if we have any person, student or teacher who tests positive, there's a mandatory 10-day period of isolation that has to take place. And Mr. Mays or Dr. May, if I say this wrong, I want you to please correct me. But and then the person can only come back once they're asymptomatic or they don't have a fever or whatever. If a person is in contact with another person who has a confirmed diagnosis, then they must quarantine for 14 days period. So you can see if and our staff are included in that. We had a previous conversation about public schools employees being part of critical infrastructure. The Tennessee Department of Health has said that we are not. And so what that means is that if I have a teacher who has been who has a contact, and by definition that means that you have been within 6 feet of a person for a period of 10 minutes, not consecutive, but cumulative. So 2 minutes in the morning and 8 in the afternoon, then you have been that constitutes a contact, and you must quarantine. So there was an example today on our call with the state where, and we have lots of calls. We have the state, we have the health department call, but 3 times a week, I'm on a call with the commissioner of education, and of course that's every director of school, superintendent across the state. There was an example today where a school in a school system in Middle Tennessee had opened, and they were operating on some form of hybrid, but they had to shut down the school because the entire front office had been in contact, and they didn't have anybody in the school to operate the school. So that individual school had to shut down. And I just want to be here with full disclosure that we could have to shut down individual classrooms and schools. The other thing is, this is true for students too. And I know parents want to have their children back in school, but if your child and you come back is a contact, that child has to go home and quarantine for 14 days and would have to, if they're going to continue learning, have to participate virtually. So I just let me pause there for a moment, and please, I apologize if I've misstated anything. Mr. Mays, Dr. May, could you either correct what I said or affirm it, please?
You're absolutely correct. If you are a case, it is a minimum of 10 days of isolation with the last 24 hours feeling well without any fever and using any fever medications. And then if you are a contact to that case defined by 6 feet greater than 10 minutes, then you are a contact and will be asked to quarantine for the next 14 days. And that a question we get commonly is that, well, I'm a contact, but I went ahead and got a test and I'm negative. Can I come back? And the answer is no, because we don't know what day that you plan on getting sick and becoming infectious to other people. So, and the real discussion was not about critical infrastructure or essential personnel. We're really trying to stay away from that type of terminology. Uh, and it really comes down to the good old fashioned basics principles of quarantining to prevent spread of disease. And that's the principle that you're referring to about critical or infrastructure or personnel actually refers to healthcare workers operating in a hospital, and they they go into quarantine, but they can come back to work with the proper PPE. Number one, and number two, they can't have anybody else to replace them, and that is the crux when we talk about critical staff. Is you don't have anybody to replace them. Then in a healthcare worker, if you don't have that nurse, somebody dies. And that's where that original definition came from, just to give you an explanation of how that came about. But for anything else, including nurses, if they have a replacement, uh, then we have to place them into quarantine. That's the short of the story.
Okay, thank you. Um, I if you're asking me, for my best thoughts, I would say this, that every teacher to a person that I've talked with, every educator that I know, really wants our kids back in our buildings uh, as soon as we can do that safely and responsibly. And I've not heard anybody vary from that. Um, if we're going to be asked to bring our students back into buildings, my best thought is that we do that with some sort of a graduated schedule, perhaps picking a date um, and trying to implement a hybrid model to help us ease into that. To be able to socially distance. There is no way that I can tell you that we can have everyone back full scale, even with the removal of the virtual learning academy students, and be able to provide 6 feet of physical distancing. Whereas if we operate on a hybrid model, we have a better chance of doing that and having some time to figure that out, to provide for the marking and those kinds of designations. It's very difficult, to do. We've had some discussions in our health department group with the school systems, absent a state metric. Are there some other things that we can look at? We have 3 zones. Could we expand that? And we're all very willing to look at that. But honestly, what we do need, again, is we need a statewide metric. But we don't have that. I want to say a special thank you and commend the Sullivan County Health Department for working with us and for coming up with a metric when no one else would give them one. And so that's the best that we have. Our first aspiration is to keep everyone well, and so this is what makes this so very difficult. My best advice and suggestion is that if the board is asking us to bring students back into the building, that we do that on a graduated or a hybrid system.
So Dr. Cox, are you making that recommendation or what are you saying?
Well, I'm just listening to what everyone has said, and so we have a variety of thoughts, and if the wish or the will of the board is to get students back into the building while we're in the red zone, so to speak, our plan does provide for that, but to do that responsibly, we have to do our best to physically distance, to require everyone to wear masks, to have better control of the egress and ingress, and those recommendations that were provided to us by our health department, because we asked the question, how could we safely and responsibly bring kids back while we are in the red zone?
Anyone have?
May I put that in the form of a motion so we'll have some facts, some dates? Mr. Chairman?
Yes, sir. I was waiting for just that.
I recommend that effective August the 24th, that we start the hybrid schedule, knowing that we have to follow social distancing, wearing masks, and that we meet all the ingress and egress rules and regulations. But that would give us 2 weeks for us to get the building rearranged, the stripes and so forth. The teachers, many of them already have things set up for hybrid because they thought that might happen to begin with. It would also give all the supervisors a chance to make sure that they can meet the social distance as one, and that we stay on the hybrid schedule until after Labor Day, which would be, I think, September the 7th, I believe. But that would give us time to slowly move into it and then make a decision of whether or not we needed to continue on that. And that would be K through 12 on the hybrid schedule, starting on August the 24th. That would be my motion.
We have a motion on the floor. Do I hear a second?
Can we get clarification on would they continue virtual learning until the 24th and not have an end date necessarily, because you can reevaluate based on their health department?
Randall, could you repeat that? Well, you had an echo or something.
Yeah. So I said, could we get clarification that we'll continue in the virtual format until August 24th, but not put an end date on, since we're going to be reevaluating the data based on the health department, not necessarily say we're only going to do this to Labor Day.
Okay, I will amend the motion then to say that we will continue in virtual learning until the start of the hybrid schedule on August the 24th, and that we remain in the hybrid schedule then until this board makes a decision to change that date. Would that be?
I'll second that motion.
We have a motion and a second on the floor. Discussion on the issue.
One question, and it follows Mr. Gilmore's point of clarification. Are we scheduled to meet about August 13th again as a board as well?
Yes.
I just want, I know we all know that, and I know that we've put it out publicly, and I know we've had technical difficulties, but for any recording or anybody that watches this, I mean, we're gonna continue to try to meet on this, and continue to evaluate. It just be my hope, and I think it's everybody's desire. So we would be meeting again as a board already scheduled before it actually went into effect.
Thank you. I'm going to ask, is there any more comments from the board?
I got a question on it. Okay, we're going to say the 24th. Are we sure our resources, we're going to have all the cleaning supplies, all the PPE and everything we need to actually start on the 24th?
Mr. Robinson, I would make my motion contingent on the fact that we do receive those, and we would treat it just like a snow day or something else. If we find that we do not have the supplies come in on time, then we could continue through the virtual learning for an additional day. Because I do think the virtual learning now gives us a chance to take advantage of the 13 built-in days possibly, and it would allow Dr. Constant to make that call if the equipment is not there on time.
And also, Dr. Cox, I guess, will our teachers have time to split up all these teachers or all the students by the 24th into the A and B group?
So one of the things that we did during our principals retreat was do some of that work about what would it look like if we operated in a hybrid schedule, and basically the schools have figured out what 50% of the population is. There will have to be some adjustments made, because one of the things that we would prioritize would be keeping families together on the same schedule. But we have done some of that work already. I don't want to indicate that we're ready to do that tomorrow. So I feel like we could be ready potentially to activate that, but we obviously need to work on it some more. If we're not able to, then I would come back to you and ask you, for an extension if we needed to.
Anyone else? I'm going to speak again on behalf of those 4,000 or 5,000 parents that do not have an option and do not have daycare, and those children that are behind, are getting farther behind, that will not benefit from virtual learning. I don't think. I'm not a fan of the hybrid for some of the same reasons. I think it's almost the worst of both worlds for children, and for those parents that don't have daycare for 5 days, they don't have it for 2 days or 3 days. So I just want to make myself clear. That's my differences. Does anyone else have discussion or questions?
I got another one. Sorry, this involves me. I've been on Graveyard since March, so I completely understand how the parents. I got the wife fussing at me and everything for the Graveyard, but would it make it, Dr. Cox? Would it make our staff say we plan on the 24th, and then the next week step to our middle, the next week step to our high school? Would it balance it out? I mean, would it help each grade level, say that K through 5th, the first week? Could our middle and high school teachers, principals, maybe help with the elementaries, and we can see where we need to change stuff and possibly get it changed quicker?
So I was having a little bit of difficulty hearing you, Mr. Robinson, but I think you asked me if we could phase that some way. Is that what you were asking me?
Yeah, if we phased it, say we done K through 5th 1 week, and then next week we added the middle school 6 through 8, and then the third week we added 9 through 12. Would that help our school system to go into the hybrid? Would that be better on our staff instead of saying all of our school system is going to hybrid the first week?
I don't know that it would. I really would like to have some time to think about that. But I'm not thinking immediately that there would be a lot of benefit to that.
Okay, here's my next thing. We've decided we're not going to be ready the 17th. I'd like to make a motion. We table this until our next meeting on the 13th and make a decision. Dr. Cox will have more time to go over and come back with more instructions on how he feels we need to proceed with this.
We have a motion to table till the 13th. Do I hear a second? Jane, are you saying you second? Ms. Thomas, are you saying you second? Shake your head. Okay. Ms. Thomas seconds the motion. Discussion on tabling the motion.
I guess the only point that I would have is I know that the parents want to know a little bit more planning. I think if we wait to the 13th to tell them what we're going to do on the 17th, that's going to put them in quite a bind, or it would put me in a bind to sit back and say, I don't know what I'm going to do with my kids 4 days from now. But that would be my only comment.
I would agree with Mr. Iverson. One of the purposes of this meeting, and one of the reasons we put it off, is to maybe give some solid information out there so our parents could not be living day to day, week to week, and have some planning and know what's coming. So that would be my only opposition. Anyone else?
And I agree with you, Mr. Hughes, and Mr. Iverson, and maybe to help clarify Mr. Robinson's point, the way I took his comment, and I know we haven't voted on it yet, but I read into what he was saying that given that it appears that we may not make a decision until the 24th, that was the purpose of his motion to table it till the 13th. So, and I know that is a bit different than the purpose of the called meeting, but I'm trying to be transparent, and I think that that's what we have to continue to do and be honest with everybody that we're dealing with, that this is evolving every day. So I can understand that from both points of view, would be my comment. And I do have a little bit of concern about trying to have a fixed schedule. And I know that's all of our desires. And I know that planning is very, very important. Trust me, I've got 3 kids and we both work. But we also have to be honest that no matter what plan we end up voting on, if we're really doing what we're supposed to do in this role, we're going to have to adapt, and that plan may have to change, and it's going to be painful for all of us. Just like it's not fun to have these kind of meetings Friday night at near 7 o'clock, but that's what we kind of all got to suck it up, not to play this down at all, because I understand how serious this is, and I understand how serious Mr. Hughes' points about the kids that are being left behind, and that is really one of my biggest concerns as well. Otherwise, I mean, it's pretty easy to say, look at our data, we're not going back to school, I'm voting no, but it's that young K through 5 age group and the kids that really, like Mr. Hughes said, that's the biggest agent for a leg up. And like I said earlier about my view about public education and why I love it so much. So that's kind of my biggest concern as well.
I guess if I could make one more comment on that. I understand what we're trying to say as far as we want to put a solid plan in place. And I think the parents are really, they want that. They want us to say, this is what we want you to be decisive. We want you to say, this is what we're going to do. And we all know that we have to be flexible enough to say that we may make a bad decision. And if we do, then we're going to get together and we're going to make another decision. We'll have to look at that. The one thing that I would really like to say, though, is whatever we decide to do today, I think that we need to make our August 13th meeting open. I think we need to allow parents to come. I think we need to maybe get the more doctors that, like you, we've all read that letter from the doctors. We've had pediatricians and other people, because, I mean, I respect Dr. May, and I respect Gary Mays, but that's the only opinions we're getting from the medical facilities or medical fields. And we've gotten a lot of input from other places, and we've read a lot of emails from other places. But I think if we're going to say we're going to go back to some sort of a hybrid and allow kids to come back to school, it's pretty bad of us to say we won't allow the public to come talk to us, although we're not going to sit in a room with people. So I would think that whatever we do, we need to open up our next meeting to allow people to come and give us some opinions or let people talk. Kingsport, when they did theirs, even if we have to figure out a different platform, maybe we're not going to use Google Meet, but there's other platforms out there that allow people to participate and talk and have input. And I think the parents really, I think they're frustrated with the fact that they're not getting to interact with us. I mean, I don't know about you guys, but my phone's been blowing up the entire time we're having a meeting, and people want to say, what about this? What about this? What about this? So it would be fair, I think, of us to say the 13th, we have to somehow allow these parents to talk. But that's just, I'm wanting.
I agree. And just,
Yeah.
I would like to be clear that we really had anticipated being live before now. And I would fully agree that we really need to get to where to parents and people can talk to us face to face. I don't know of any reason we couldn't be in live the 13th. Is there?
Our boardroom is being used as a call center, so we would likely have to find a different location for a public meeting.
All of our gyms are open.
Well,
if you ask us to find an alternative location, we certainly can do that. We would have to figure out, how to physically distance and whatever precautions that we would need to take in order to accommodate a public meeting. We would have to work out those details.
let's find a place.
Yeah.
And let's get to where the parents we can be live.
Yeah, I agree with Mike and Mark. I mean, and my phone's the same way, Mark. I think it's only fair, and that goes to my transparency, which I feel like, to be quite honest, not to get off topic, but I feel like this board and our staff has always done a better job of that than maybe has been portrayed. And so I'm all for hearing more in public. And I agree, Mark, if we're going to ask people to come back to school, then, we should be willing to let them come talk to us.
Okay, we have a motion and a second on the floor to table the meeting. So anyone, if the discussion is over on that, we'll have a vote on that. Everyone.
Actually, I guess I want to clarify one thing with Mr. Robinson, what he's saying. Were you making a motion, or were you wanting to try to make a motion that we would extend what we're doing now to the 24th, and then we would table it to the 13th? Was that, or what was that? I just want to make sure I'm not misunderstanding what you were saying.
Yes, pretty much that's it. Because we've all pretty much, I feel, I may be wrong, but I don't think any of us feel that we're going to be ready on the 17th. So we're going to be hybrid to the 24th. And I just don't want to make a decision tonight for the 24th whenever we don't have all the resources and we don't have everything ready. And I would personally like for us to talk to the principals and see if they think it would be better if we done it in weeks, a K through 5 1 week and middle the next, or so you go K through 7 1 week and then 8 through 12 the next. I'm just curious if it would help them in the hybrid for first week, if they could get help from somebody else and actually see some of the stuff instead of us just complete hybrid the first week, and we're kind of like we was this week, and we're not 100% gonna get thoughts. I hate voting on something. Next week we may have to change it because we ain't gonna have stuff ready for the 24th. That just worries me.
I think Miss Thomas is trying to speak, but I don't think anyone can hear her.
I can try to call her.
There's something wrong. She's going to call somebody. It won't be me. I don't think I have her number.
I don't know what's wrong with my computer, but anyway, I appreciate the information we've gotten from Dr. May, and I know he's looked at all this, but we received letters from 5 pediatricians, and listen to this. It sounded like we're basing a lot of our cluster numbers for red on nursing homes and prisons. So that's a little puzzling to me when we have a school population to deal with, and we have pediatricians recommending that, saying we can safely come back. So that's the reason I seconded the motion, because I'd really like to look at that further for before the 24th. I'd like for us to look at it. All right? Okay.
Anyone else?
So just to not beat a dead horse, but to further clarify, just if we know what we're voting on, it seems like Mr. Robinson's motion is that we continue to virtual till the 24th tentatively, and that we reconvene on August the 13th and allow for public comment at that meeting from parents, with the precondition that we'll do that in a safe manner, as Dr. Cox said, and follow guidelines about social distancing, but allow for in-person comment from parents.
Correct, Paul?
Yes.
Okay. If everyone is clear on the motion.
May I comment?
Yes, sir.
If we table this without a date until the 13th, the teachers have no more planning time unless you've set a date. So if we kick the can on down the road about when we're going to do it, all we're doing is saying on the 13th, if we decided to open up on the 24th, that they would only have 10 days then. So if we don't have a date certain for them to be looking to and for parents to be looking to, they can't make any plans. All we've done tonight is waste 3 hours of talking and haven't made any decisions. And
Anyone else?
I guess to be, if we're going out to say to send them on the 24th, and something comes back and we don't have our resources for the 24th, we have to change it. We're the same boat. I just feel like if our teachers are watching tonight, they know what we're looking at. They know what we're looking to do on the 24th. And Dr. Cox will too. So I would think if you were implementing, when you start doing this stuff, it's possibly going face to face sooner than later. That's just I just hate to put something out there that will definitely happen on the 24th, and let's change it. And I like Anderson to call me and fight. It'd be nice for the parents to be able to actually come and talk about it.
I agree with I agree with the one thing that Randall was saying is that I think it would be good for us to say, if we're going to back it up, we're going to start this on this certain date. I think that if we give them more time to plan now, and they start for a week and they're planning towards opening in a hybrid or opening fully, whatever we decide to do, and then we back it up and say, okay, we're not going to, that might be wasted time, but at least it'll be wasted time towards the opening in hybrid. But if we wait for another week and then we spring the hybrid on them, it does sort of cut into their planning time. So I do like saying, if we're going to delay it for a week, we're planning on opening hybrid, start your planning, start your classes. I mean, because that just gets everybody in the right frame of mind and lets them have a plan, because again, that's what we're talking about tonight. We want to give some clear guidance. And we do know that when we come back together next week, things may change. We may have different guidance. We may have different numbers. And at that point, if we choose to, or if the things are leading it to us, or after the parents make their comments and we say, okay, you're right, we're going to do something different, I don't think that that's totally wasted, but I do agree that if we don't give them some kind of guidance, the teachers are going to kind of be in limbo again, and it's actually not a good thing.
Are we ready to vote?
Well, I'm not sure if it's proper under Robert's Rules of Order, but I don't know if I can move to amend that motion that Mr. Robinson made along the lines of Mr. Iverson and Mr. Jones' comments, because those are fair points. If we were to just add on to Mr. Robinson's motion that our intent is to open in hybrid on the 24th and potentially full on the 24th, and then allow for that comment from the parents and continue to evaluate the data, then our teachers and lead staff can continue to plan, realizing they're going to be able to come voice some opinions as they have on text and emails, but in person as well. I would make that motion. I'm not sure if it's technically proper. Mr. Jones, probably.
It's not. We either need to table my motion, vote on it, and then if it gets is voted to be tabled, somebody make a motion then for something else. Right now, the waters are so muddy, I'm not sure.
Yeah. Actually, I think he could amend your motion. He could actually vote to amend your motion. We'd have to vote on the tabling first, but yeah.
We got to vote on the table and then.
Or somebody could always withdraw one motion and we could make a new one.
Good point.
Hey, I'm thinking this, I need to withdraw my motion to table. We're going to put more stuff into the table and then possibly start on the 24th with a hybrid or a phase 2. Is that what I'm getting?
How about could you restate your motion if he just withdrew his?
I'm not really sure what you said, Paul, but my original motion was that we start on August the 24th with the hybrid model, knowing that we would be able to social distance, we'd wear a mask, and then we'd make sure we met all the requirements on the ingress and egress. This would give the teachers 2 weeks to plan for this. This would give the parents a date certain of when this was going to happen. It would give them time to make arrangements with babysitters and everything else. It would also give the principals time to make sure that they communicated with the parents what the hybrid schedule is going to be, because they're going to be 2 days in 2 days in class, I believe, and 2 days or 3 days then of online learning. That way the parents would have that information ahead of time. If we postpone the date of making the decision, the principals won't have those assignments made in time. But if you want to make a motion to table it, then table the motion that I made, and then someone else make a different motion that would give you something else. But I just want some clarity for the teachers, and for the parents, and for the principals as to what is expected. And I think that's what the parents, that's what they've been asking me for. Tell us what it is that you're going to do, when you're going to do it, and how you're going to do it. And if we can do those three things, we need to move forward with one or the other.
But for right now, don't we still have a motion to table on the floor? We had a second. Hearing no more discussion, we're going to vote on that motion. He could withdraw it, but I don't know if.
Yeah, I thought he did.
I can't hear him. But did you withdraw your motion, Paul?
Yes, I withdrew it. I get what Jones is saying about all that. I just don't want to. I don't want to put it out there and we vote on this and everybody be like, they say in the paper tomorrow that the 24th, we're going hybrid 4%. There's no backtracking, because that's what they're going to do, and that's what worries me. I guess my reason for wanting the table was the fact that we could push it off to the 13th next Thursday, We can make sure we have all our resources, and we can have everything in place, and we can make a better judgment on the 24th. And then Dr. Cox could come back with how he thought we needed to proceed with going to the hybrid, if we needed to bring the students up a grade level to bring them back.
Okay. We've withdrawn, if that motion is withdrawn, we still have Randall's motion on the floor with a motion and a second. Any other
Well,
discussion on Randall's amendment?
One point of clarification for Mr. Jones' motion and kind of to Mr. Robinson's point, and I think all of our concern, and that's why I really appreciate Mr. Jones being on here, because he's been an assistant superintendent and he understands all this scheduling a lot better than I do. Is it my understanding, Mr. Jones, that your motion would also acknowledge that we're going to have a meeting on August 13th and allow for public comment?
Yes, that meeting is already scheduled, and I, for one, would almost make a motion that this be the last meeting that we ever have online, because I have missed quite a bit of the conversation. But it's already scheduled for the 13th, and I would hope that we would have it, and it would be in a place where the public can make comments.
Okay, thank you.
I would just make the point that these virtual meetings may be a whole lot like the virtual classroom, and they were the idea of people way above us to begin with. It was never our idea. So anyway, we've got a motion on the floor, and we have a second, and we've discussed it at length. Are we ready to vote? Christie, call the question.
Mr. Hughes,
No. Oh, wait a minute. Yes. No.
Yes, no.
yes or no?
I'm voting no on the motion to go hybrid for the reasons I stated in discussion.
Mr. Iverson,
No.
Mr. Jones,
Yes.
Mr. Robinson, Mr. Robinson,
Yes.
Mr. Spivey,
Yes.
Miss Thomas,
For the record, she's saying no.
Mr. Gilmore.
Yes.
Thank you. Next order of business, and we can't take as much time on these two, is the consideration of athletic participation for fall sports. I make a recommendation that we proceed under the guidelines of the TSSAA in Section 5, is it, Dr. Cox? And we proceed with fall athletics. Executive Order 55, to be more exact. So that's my recommendation. Do I hear a motion?
So moved.
Motion by Mr. Jones. Do I hear a second?
Second.
Second by Mr. Iverson. Discussion. Hearing none?
Mr. Jones,
Yes.
Mr. Robinson,
Yes.
Mr. Spivey,
Yes.
Miss Thomas,
She's saying yes, Christie.
Mr. Gilmore,
Yes.
Mr. Hughes,
Yes.
Mr. Arson.
Yes.
Last and final piece of business we have tonight is I wanted to bring to the board a discussion about the possibility of turf at the two high schools. And the reason I'm bringing it now is we have now have a athletic boosters club between the three schools, Central, North, and South, that's been formed. They asked me to mention it. We have talked to Deneen on the high school. They had to hold up this week. That's how far along they are on construction. They're at the point almost of no return. Now, the points, it's worth noting that to do it now at this point of construction is much cheaper than any other time. A lot cheaper. And it's also worth noting that we didn't allow anything in the budget for turf at either school, either high school. But there was a company that did it for, I think, Hawkins County for two schools for like $750,000. When we started looking at this originally, it was going to be $1.1 million for East and $550,000 for Westridge if we did it in the early stages before they already had the drainage and things like that done. I know this is late notice, but they asked me about it, and I did not want to not give the board a chance to know that it had been brought up. Dr. Cox, if you wanted to fill in some of the blanks on the company, I think it was, and the type turf, if you have some more details. It's really probably unlikely that we can do anything tonight, but we have to let the contractors know Monday which direction they're, can expect it to go. Any delays right now is going to hold up construction. So, Dr. Cox, if you would like to add anything.
I don't really have a lot to add. I do know that the company that Hawkins County uses is not a company that I'm familiar with. In my former district in Maryland, we did have quite a bit of experience with a company called Field Turf, and is a very good product. I just simply don't know. I didn't do any of the work, obviously, about and I'm sure the folks in Hawkins County did. But we don't have bids. We don't have any real hard numbers in terms of cost. I mean, nobody has submitted. We've not put out for bids. So we're talking about if we did that, a project of that scope would have to be bid. I'm assuming Ms. Deloach, and so I mean, we're talking about an extent, probably at least a month to 6 weeks before we could get an RFP out and get bids back.
Like I said, I just wanted the board to know that the Boosters Club had made the call and asked me to mention it. And I realize it's probably nothing we can really do tonight, but I didn't want you to find out that they had been asking about it and you didn't know anything about it. Anyone have any comments or anything?
Just one comment. I know that, again, a lot of us have been out at the polls and talking to parents and a lot of emails and stuff. And the turf has been brought up several times over the past just a couple of weeks with me. When we're building a high school, we're building a big high school, and we're going to be competing with big high schools. I think that building that high school to the best of what we can possibly build it is a great idea. I think we had information from some of the sports writers and things that our press box might be too small. And we actually looked at that early on of maybe like another 60,000, I think was what that would have been to expand. And I think having turf at that facility is a good idea. And I think that it's something we should actually do at the high school. I guess the problem I have is that I think until we have everything at that high school that we've promised the community that we're going to have at that high school, I don't think we should be taking money. I mean, I don't begrudge East. I have no problem giving that to East, but I don't think that the timing of that is now. I think the timing of getting the high school built the way it's supposed to be, doing turf when you're actually in the process of building is a good idea. I mean, until we can, I have to be honest with you, I am so tired of hearing we're not going to have a swimming pool at that facility that I really would like for us to address that, because we actually talked about that early on. We actually asked Deneen West to bring us a price, and we were supposed to look at that, and then we're supposed to vote on that, and it never really materialized. And it's hard to answer those questions, but until we're able to build that Westridge High School, the shining star that we've promised everyone, I would really prefer that we say we're going to do turf, we're going to do a press box, we're going to do a pool, and then let's worry about the other high school whenever we have what we're supposedly doing on that one done. But that's, again, it's just my opinion.
Well, of course, I disagree with your opinion. But having said that, a few things that you mentioned about the pool, we did have a price.
It was never brought to us.
$5 to $8 million. How many people remember that here? Randall, do you remember that? Pardon? Do you remember that price? I'm seeing a thumbs up from Aaron, but she did bring a price to us, and we knew that we didn't have 5 or 8 million to put on it, so we didn't go any further with it. She actually had a rough set of plans. She didn't do an extensive set of plans because that was going to cost like thousands and thousands of dollars to have the drawings made. But she did a rough set and brought them to us. But I think at this point, when we add something extra to high school, I mean, we're down to 2 high schools pretty soon. And we do the same thing at both schools. And if we can get some kind of really good price like that, there would be no reason not to. And even if it was full price at one school and 550 at the other, that's 1.6 if we could come up with the money. But right now, that's, you know, getting the money moved and all that taken care of is the biggest thing. But I've always been in favor of turf on both schools, but you have to have a way to pay for it. And I've got some ideas how to do that, but we, you know, first of all, I wanted to see if there's interest, but understand that if we slow down here, the high school is going to be finished and we're going to be going there. But if we slow this process down any, they'll be playing football somewhere else, maybe for the first year until they, you know, if we slow this process down. We're on schedule now, but we can't slow down any in the construction phase. We've got to move quickly if we do it, is what I'm trying to say. And I don't really know that it can be done that quickly. But I just wanted everybody to have a chance to know what I was hearing.
Mike, is there any way that we could get more info on that timeline before our meeting next week? Because I mean, I don't disagree with your points, and I completely understand where Mr. Iverson's coming from too. I also don't want to hamstring the new high school by tying it to something else if that's going to prevent us from getting both when we're trying to get funding. But I'm just trying to understand that timeline a little better since we're going to be meeting again in less than a week.
I talked to her Monday. I told her that she really needed to know by Monday, and they held off till today. She sent me a text when this meeting started and asked me if I knew anything yet. So that's how pushed for time they are. They want to know now, and they're going to be starting work on that Monday. And they were going to start last Monday, so they've already set on it for 5 days. Wait until because originally we were going to have this meeting on like another date, and we changed it. So
right.
So I asked them to hold off till then, and then we changed the meeting. And really, to be honest with you, one of the reasons I wanted to meet, I had the meeting scheduled for Tuesday anyway, was so that we could get some discussion sooner than later for her. So
okay,
that's the reason. The timeline is we're out of time. So it was just I just got the call last, just a week or so ago.
I guess the tough part would just be, I mean, is there anything, even if all of us 100% agreed, I mean, can we really formally do anything without being able to move money and get approval?
I guess I have a question that same, or even maybe a suggestion. And I know we disagree, and that's fine. So but could we put something in place to where we say an up to amount on that? And I mean, I would still just say for Westridge, because I'm like, finish the one we're doing. They're the ones that has a timeline. That's the one that has to happen now if we're going to do it now. And if we say up to 700,000, if we're saying it's 550, that would give us some room on that. And that's what we could actually send to the county commissioner, because that's going to have to be sent over. They're going to have to approve us moving money. But I really don't think if we're in a time crunch, let's worry about the one that's being built. Let's worry about the one they have to know the answer right now. And then let's worry about the other one when we're at that point.
Well, I would say to that, forgive me, but for a school that's been in existence for 51 years and for students in 3 zones to be getting ready to be served by a brand new facility, to tell that other zone you don't count right now, I have a real hard time with that.
Well, they have a $20 million middle school that just opened up. It's hard to say they don't count.
It's not the high school. We're talking about the high school.
I'm talking about the zone you just said.
You really have a hard time, I think, getting support for that. But the other thing is we'd have to find out how much it was going to cost, and I think we could get a good price for both schools if we did like Hawkins County did. I think we would have to first then decide if the board would support trying to come up with the money, and then if we could get it moved, and we would be jeopardizing that first season on that field, possibly, if we went that route and everything went smoothly. And then if it failed, we'd be jeopardizing it, would still be on grass. So I've looked at some I first want to see where we're at as a board, and if we again, anything we do could jeopardize the start time unless we just said move on with grass. Now, I'd told her that in April because I couldn't get any traction on this issue. She had talked to me about it. We had so many irons in the fire. I said, keep moving. I'd talk to you about that. So we're now at a point where we're kind of out of time. Now, the only thing difference is we've got a boosters club now that's taken an interest, and I'm glad they have. I've talked to them. I've talked to one contact from there. So if we and I've been on the football field a few times. I like grass. There's some downsides for me for turf, except it lasts longer, it wears better. Economically, over time, it's probably a good deal for everybody. But as far as playing on it, I like grass. But it's a status thing now. Everybody has turf. It looks good. It's easy to maintain. Has all those pluses. But as far as a practical thing, it gave me the choice. I'd rather be on grass, but except for the real muddy nights or that type of thing. But But as you know, everybody around us is getting it. And it would just look crazy one day to look back and say, boy, if we'd just done something then, we could save $500,000. Because it's about $1.1 million normally is the price I got in most cases. But I don't know how this firm done it for two fields for $750,000, whether it was because they had two big job that they contracted at one time. I don't know how they did that, but that's what's been published. But from the point that high school is finished forward, that's one of the selling points is now we down to two high schools and we can make both of them really nice, more like the city schools, and that's what I'm going to do. I'm not going to leave out one for the other. I've supported this high school and I'll continue to support it, but not at this point. We have two high schools almost, and I'm going to see that they both get their share. I guess the question tonight is, do I ask her, do I tell her to move on or tell her to tread water?
I mean, Mike, are you basically just asking if there seems to be some interest from the board in trying to obtain that pricing and see if that's something that's feasible?
Yes, I'm saying, are you willing to? Would you like to take some time and look at it, or knowing that taking time to look at it is going to probably cause us to play at South or somewhere the first few games or something that could happen? That's going to happen probably.
Well, I mean, I completely get where you're coming from, and I know you have to deal with a ton in your role right now, but I find it hard to believe we'd miss a few games of football over 6 days. So, I mean, in the sense that we're meeting again on August 13th, I know our primary goal will be getting kids back in school, but I definitely have no problem saying I'd love to hear what info we could obtain, before the 13th on that issue, if we could wait 6 days.
I'm just repeating what our architect said, and but I will tell them to tread water for 6 days if that's what the board asks. If you want to take that much time to think about it. I don't know if that would require an official vote or just a consensus here, but just wanted some guidance.
Well, this will require us going to the county commission to ask to move the money. Is that correct?
I don't think there's any scenario that wouldn't require that we every option that I've looked at in the budget would require permission to move the money, along with the challenge of finding the money to begin with. I do have a few.
Would we have to have permission to move the money before we requested bids on it? Or could we go ahead and make the request to move the money and move for bids at the same time?
I guess that's an Ingrid question, but I would think that we could do it at the same time.
Kind of wishing she wasn't there.
She's so quiet.
I don't know how you're gonna move money when you don't know how much money you need to move. You can move up to a certain dollar amount and you'll be great as long as you come in under that dollar amount, but if you go above it, you gotta go back. So do it all at the same time would be a little complicated, but it could be done. And what I would recommend is, and probably what we'd have to do is, however much money we have, we can approve up to that amount, move it, get bids, and then when it comes back, you're looking at a good month to get bids in. Right.
And then you have to develop an RFP, so that's going to add time to that structure.
Thank you.
I guess my question is, who moved the money that we got? Is that going to projects that we have planned on other schools right now?
I didn't hear him. Did you hear him?
You're saying that we'd have to find money where plus money that is not we got on some of the other schools in our county right now.
I think I heard what you said that time. Anything we take and spend on is going to be taking money from what we could spend somewhere else on another project. We don't have any money sitting anywhere in a turf fund, per se. So I guess theoretically, yes, any money we took to use for turf would or could be money that we would or could use for something else.
I think
am I answering what he asked?
I think I understood what you're saying, but if we decided to do this, we could actually take it out of our fund balance and not take it out of our budget. So if you're asking if we took it out of our budget somewhere, would it knock something else out? It depends on where we took it. If we took it from the fund balance, then no, it would not knock anything out. So I think if that's what you're asking, I'm not really sure. I just got part of it.
Anyone else? I guess the question now is, do we think about it for 6 days?
I'll take it out of our budget. So if you're asking if we took it out of our budget somewhere, off something.
Front and then go back later and do it, it costs you as much as could be as double because you have to redo the grade work and everything to go back and take the grass out to go back to turf. So there's a lot more to it than just what's at the surface. You literally have to think about if we do grass, it's got to have the irrigation that it needs. If we try to do grass one year, then come back and change it, it's going to be way more expensive than just doing turf from initial. Just something to think about.
Thank you, Mr. Flannery. Anyone else?
I mean, I probably agree with both of you. I mean, Mike, I get where you're coming from. I don't want to delay anything, but I also, I would like a little more info, and I feel like Mr. Iverson said, we're gonna get some response based on this discussion, and I think there will be some people that are on the commission that would probably support some resolutions related to this after hearing this discussion. And I completely understand both your and Mr. Gilmore's points about East High School. I mean, I can attest to 20 something years ago playing on those fields in football and baseball against East, and they look much the same as they did then. So I completely do get where you're coming from. And there is a drastic cost savings of doing them both at once. So if we could just get a little more info and maybe in those 6 days hear back from our some of our funding body and try to communicate like we've all talked about we want to do, then I don't see that would drastically hurt us either way.
Thank you. We just do it, and we realize if we come up a little short on getting finished, we did it. Not, we're making the decision right now to take that risk, and that's okay with me. For that kind of money, it's worth waiting a little bit if it turns out we are able to do it, or it's worth the time probably to take to think about it. So if no one disagrees, then I'm going to tell her to hold up until we meet next week. Everybody, if you disagree with that, tell me now. I mean, we won't have to have a formal vote. We're not voting to spend any money or anything, but I'll take that as to tell her to tread water till next week's meeting. Dr. Cox, I don't think we have anything else left on the agenda. Seeing no more business, unless someone has something else, I guess we stand adjourned.